Data from a US-based think tank shows that the Philippines exceeded the combined total number of new cases from other Southeast Asian nations yesterday. And in Sorsogon, Governor Chis Escudero's words today was even worse. He thinks our ASEAN neighbors must be doing something right that we aren't. Let's now get the perspective of Pediatric Infectious Disease Specialist Dr. Anna Ong Lim. She's also a member of the Health Department's Technical Advisory Group. Doctor, thank you so much for joining us. Tell us, Doctor, why can't we get our COVID-19 response right? Let's break down the numbers of our ASEAN neighbors. Thailand, no new cases. Vietnam, only 3. Singapore, 17. Indonesia, 6,000 cases, but with a population of 270 million. We're at 108. What are they doing right that we aren't?
Well, I think some of the bigger concerns that countries who have lost their grip on the numbers has been the usual problems with contact tracing and early identification of cases. So when you look through the data coming from different countries, those who get their acts straight usually have very good contact tracing systems, and of course it goes without saying that they're able to identify the cases very early in the game and get them out of circulation.
So is this an indication then, Doctor, that the government has failed our kababayans? The government has failed the people?
Well, we've always said that the contact tracing efforts that we are implementing can stand to be improved. Earlier on, during the start of the outbreak, there was a figure that was supposed to have been targeted, 1:37, no? For every individual case, there should have been 37 contacts traced. And this is actually based on scientific publications. But this has not really been consistently implemented because it really does take a lot of effort to get this done. So that's one aspect that can really be improved. But also, on the other hand, we need to take a lot of personal responsibility as well. And even in the context where we were never really able to put that 1:37 in place.
Yes.
The surge is happening now, di ba? Parang hindi naman siya nangyari earlier on in the game. So there are other factors to consider.
I know so many factors to consider, Dr. Lim. But it seems like we keep on pointing the finger on different people. I talked to our contact tracing czar. He was saying, well, it's the fault of the LGUs. According to the DALG, it's the fault of the LGUs. So how do we really get our act together? I mean, there's so much bureaucracy and pointing fingers. So the bottom line is, should we just revert to tighter restrictions, such as MECQ, to bring down this infection rate?
There will be a place for that, Rico. I think it's well recognized that the entire the intervention, or the most effective intervention, is really just to stop people from moving. But if we do that and we don't learn how to resolve or figure out the lapses in the system, or the gaps that we need to plug, then this will be a really temporary measure, and in the end, we will have to do this all over again at some point in the future. No?
Yeah.
So if we go ahead, if there will be some kind of lockdown or tighter community quarantine imposition, then this has to be tied together with actions that will really resolve the gaps, so that we don't have to do this once more sometime further.
Yeah, because the only way to really bring down the infection rate and to keep people at home is just to go back to the enhanced community quarantine. I mean, we're seeing old problems resurfacing over the past year, and now, Doctor, there are even calls for an overhaul in the IATF. They're saying we need fresh leadership, fresh minds to manage this COVID-19 response, include more doctors like yourself in the team, scientists, the private sector, to manage the response before it gets any worse.
Well, to be fair, the IATF has had or has taken into consideration inputs from um, the healthcare sector and the economic sector. I think it's just really how would you put this? There's so many moving parts to get to get going.
Yes.
And you're right when you talk about there's a need for coordination, there's a need for um, more interaction between the players so that the system that needs to be in place to get things going
Yes.
will really run more smoothly.
But doctor, you
Now,
say there are many moving parts, but among our ASEAN neighbors, there are also many other moving parts. But the number of infections are in the single digits. And
Yes.
you know, doctor, as our kababayans wait for the vaccine, we don't even know when we will all be inoculated. I've been reading posts in social media and Viber groups about a medication called Ivermectin as a treatment for COVID-19. It's an anti-parasitic drug for some animals. And some say it's a game changer, but the DOH says it hasn't been approved yet by the FDA. But Filipinos now are desperate to find some kind of medication to protect themselves from COVID-19.
So that's a lot to unpack, Noriko. You bring up a lot of issues that
Yes.
are on people's minds right
Yes.
now. So maybe if I can address the points. First, is there a need for a lockdown? I think the bottom line we need to think about is how will we get people to stop moving around so they stop getting into contact with each other and stop spreading the infection. So whether that's in the form of a lockdown or looser restrictions, but the point is people need to stop moving around. So if we
Yes.
need to understand the objectives to get the results we want, right? Now, short of that, if we're not able to impose a lockdown, then we get people to stop moving. Now, in the meantime, while people are still moving, how will they prevent themselves from being infected? There's this school of thought that thinks, okay, ivermectin might help. Again, we have the same goal. Everybody wants to not catch this disease.
Right.
But what is proven right now is really still consistent use of mask and shield and physical distancing and circulation. You know, it's nakakaturete pakinggan, di ba? It's always the same thing, but
Yes.
that's the thing that's proven. Now, ivermectin doesn't have evidence as of the moment. There are a lot of studies going on. I hope it proves something, really, because it's accessible, it's cheap. But while we don't have the data, why aren't we using the stuff that has the data, right?
So we would like to thank you for joining us tonight. There's just so many things to discuss with you, Dr. Lim, but we've run out of time, and we appreciate you joining us on The Final Word.